Hi, I'm Dr. Brandon Elnekaveh, and I'm a plastic surgeon here at the South Florida Center for Cosmetic Surgery. Today, let's talk about one of the most empowering and confidence-boosting procedures that we offer, the Mommy Makeover. Pregnancy, childbirth, breastfeeding, these are all life-changing experiences that change the body in profound ways. A Mommy Makeover is a fully customized set of procedures. These are designed to help restore your body's shape and contour after these changes. It's tailored to your needs. Whether it's your breasts, abdomen, or genital area, we're here to help you feel confident in your body again. The most common areas we address are the breasts. After pregnancy or nursing, the breast can lose volume or sag. A breast lift restores the shape and position. Typically, this either requires a lollipop-type scar or an anchor, depending on your anatomy. I'm able to remove excess skin, lift the breasts, shape them naturally, and make the areola size smaller if necessary. If you're looking to increase volume or add fullness, especially to the upper poles of the breast, a breast implant can be added as well. If a breast lift isn't adding enough fullness, there are several ways we can add some more volume. There are three main options: a saline implant, silicone implant, and fat grafting. Saline implants are silicone shells filled with sterile salt water. On the other hand, silicone implants are filled with silicone gel. Both types come in different shapes and sizes to match your body and desired outcome. Patients often ask me which is the best one for them, and it really depends on their own priorities. Both implants have positives and negatives. Silicone implants may possibly feel a little bit more natural and may camouflage rippling a little bit better. However, silent ruptures can happen, and the FDA does recommend regular screening. On the other hand, if a saline implant ruptures, the saline is absorbed by the body, and so the patients know when they have a rupture, and they can just change out the implants for a new saline implant later on. Fat grafting is a more natural option. We can take fat using liposuction from the abdomen or really any part of the body and place it into the breasts. This creates a softer, more subtle enhancement, and sometimes this method often requires multiple sessions to get you to the desired volume. Each method has its own benefits. Contact me and we can go over what's best for you. The second area that's usually affected by pregnancy and childbirth is the abdomen. The skin can become lax, there could be stretch marks, and the muscles can separate. To do this, we do a tummy tuck, or what's known as an abdominoplasty. A tummy tuck removes the excess hanging skin and tightens that rectus diastasis with a rectus plication. So patients have a low abdominal scar from hip to hip and a scar around their belly button. I'll also typically perform liposuction of the flanks or the sides in order to get a more curvy silhouette. The benefits of a tummy tuck is that it can significantly improve the body's shape and contour. It removes stretch marks and dramatically enhances body confidence. Immediately after the procedure, you're going to notice some swelling, some bruising, but you should be able to walk after the procedure and go up steps. You definitely want to avoid heavy lifting or strenuous exercise for 6 weeks. And so going back to work really depends on what you do for work. Sometimes patients are able to go back to work after a week or two. Sometimes they have to delay it for up to a month. With a stable weight and lifestyle, these results last a very long time, typically over 10 years. The last area we often address is genital surgery. This is typically done as a next stage procedure. Pregnancy and childbirth can all change the anatomy. It can lengthen the labia minora, it can deflate the labia majora or the outer lips, and it can also widen the vaginal canal. Each of these areas can be addressed and enhanced. A labiaplasty can be used to shrink and contour the labia minora. Fat grafting can be done to the labia majora to increase its volume, or a vaginoplasty can be done to tighten the vaginal canal and bring together those muscles that may have been separated with childbirth. Many patients ask me to include a BBL with their mommy makeover, but I don't think it's the best idea because the instructions for recovery after a BBL and a tummy tuck conflict. After a tummy tuck, you can't stretch your stomach, and after a BBL, you can't sit or lie on your butt. So, to sleep, I usually inform my patients after a BBL to sleep on their belly, which is something that you can't really do with a tummy tuck. Doing both at once makes it hard to heal properly and increases the risk of complications. So it's safer and more effective to do them as separate procedures. Every mommy makeover is fully personalized. We build your surgical plan based on your body, your goals, and your lifestyle. Now let's talk recovery. Remember, a mommy makeover is multiple procedures at once, and so recovery is going to be a little bit more gradual than it would if we only did one procedure at a time. The benefit, of course, is that we're getting it all done together. The first week involves swelling, bruising, and needing help with basic tasks. Even on the day of surgery, I typically want patients to get up and walk around. Next day of surgery, getting up, walking, using the stairs are all really important for recovery. After the first week, patients feel a lot better and more mobile. The swelling and bruising does continue for several weeks, and you have to make sure that for 6 weeks, there's no strenuous activity or heavy exercise. Final results take several months, but most patients feel confident and comfortable well before then. Patients typically ask about scarring. We use refined techniques to place scars discreetly, either in the bikini line or natural folds. So over time, they fade beautifully. The results? A restored contour for both your breasts and your body that feels and looks like you again. If you're thinking about a mommy makeover, or even just exploring the idea, I encourage you to reach out. We'll answer all your questions, discuss your goals, and create a plan that's right for you. Call us at 954-565-7575 or visit us on our website. If you found this video helpful, give us a thumbs up, subscribe, and we'll see you in the next one.